Sure why.
Did you name it? Title it?
Mm-hmm.
Because that was, I found out that was the issue I had last time. I didn't title it.
Oh, it says it's streaming. Okay, continue streaming then. Let's go, people. All
Yay.
right, let's see. Let me get my intro going then, and we will go. All right, everybody, welcome to our fifth Eagle Talk. Today, we are actually enjoying the we're having a great opportunity to work. What happened? Do you guys hear me?
Yeah, we can hear
Yes.
you.
Can't
Can
see
you
you,
see
but
me?
no.
No, we lost you on video,
All right,
and
well, this
your
is
screen is
how,
still stuck.
and
Like,
this is what happens sometimes when we start to try to do things and things happen. My name is Mariceli Vargas. I am the Director of Student Life and Activities. And I may actually have to get off for a moment, and I'm going to leave you with Bruce Fassbinder. He is and I'm going to ask him to take over while I try to figure out. So I might have to step out and then step back in, guys. Bruce,
no
take it
problem.
away, please.
Thank you, Maricela. What Maricela was trying to say, this is the Eagle Talk podcast, and we are glad to have you guys here. And we have a very important topic to discuss with you today. It's all about, last time we talked with Dr. Mahone Lewis about mental health, and then kind of an offshoot of that and a carryover of mental health is licensed massage therapy, taking care of the body, which will help take care of the mind as well. So when your body's feeling good, your mind tends to follow suit. So we want to get some tips today on what we can do to kind of help that along and the purpose and the benefits of massage therapy. And so we also have one of our adjunct professors in the massage therapy program, Ginger Baldwin is here. Say hi, Ginger. But
Hi.
the main attraction is Viola Crowder. She is the head of the department with massage therapy and has gone head over heels and done everything she possibly could to get this an accredited program and successfully has done so. So Viola, why don't you just kind of introduce yourself and kind of introduce what some of the benefits of massage therapy. But before you do, let me just say this is interactive. So if anybody's watching on Facebook or this WebEx and wants to type things into the chat, if you have questions, feel free to do so and we will address them just as quickly as we can. So here's Viola to talk about massage therapy and its benefits.
Thank you, Bruce. So I'm Viola Crowder Mosher. I'm the director and professor of the licensed massage therapy program here at Central Texas College. Um, we started the program here in 2014, actually, as a non-credit certificate of completion under the continuing education department. And over a period of 7 years, grew and evolved the program and went through the approval process for it to become a certificate of completion for college credit. And we are now under the Department of Health Sciences. Our goal for this program has always been an emphasis in healthcare. We want massage therapy to be taken out of the realms of uh, I don't know, extraneous frou-frou, something nice that you do for yourself every once in a while, to, really serious healthcare and for people to learn and recognize the benefits of that. Um, so to help that along, um, the reason that I even became involved in massage therapy originally was for pain management. My husband and I were rear-ended in an automobile wreck. And this was way back in 1989. Many of you probably weren't part of the earth at that time, but uh, so I started seeing a chiropractor to try to help eliminate the pain that I was having along my spinal column after that car accident. And there was a massage therapist practice next door to the chiropractor, and he says, I can't even adjust your spine. You're going to have to go see a massage therapist first. So that was the beginning of my education. Um, that massage therapy was specific to the soft tissue, the ligaments and the tendons, the muscles, the fascia, the connective tissue within the body, and that the chiropractor was going to deal with the bones, and the skeletal system, but it was the tension in the tissue, the soft tissue, that was actually pulling the bones out of place, among some other damage that I had done to my body over my lifetime. So the massage therapist, my spinal column was in a great deal of pain. And that massage therapist was the only time, my massage therapy appointments was the only time that I got any relief from that pain. And so I saw a massage therapist maybe twice a week, and then as things progressed, once a week, and then as things progressed, once every 2 weeks. And that actually became the continuum for maintenance. At that point, was about once every 2 weeks was all I could really tolerate, the pain, and then I had to have something done. And it was always the massage therapy that helped reduce that pain along the spinal column and kept me going. So massage therapy is often seen for stress management and relaxation, but I didn't get to that part till later. It was the pain management that got me there on the massage table in the first place.
Not to interrupt you, Viola, but that's one thing that a lot of people have a misconception about massage therapy. Yes, it's stress relief and it's very soothing, but we don't think about the tissues and the ligaments and those non-structural things in our body. We think about the skeletal part, but we don't think about the pain originating in tissues and body tissue and ligaments and so forth. And so that's a good plus for people to know that if they are having those kind of issues, that might be someplace they can start to look for treatment.
Absolutely. Ginger, did you use massage therapy for pain management at any time?
Oh yes, I certainly did. I'm Ginger Baldwin, adjunct professor with the massage therapy program, and well, I originally started massage therapy or getting into massage therapy when I worked as uh, a nurse's assistant, actually, and I worked in a nursing home, and the touch therapy that we were giving to the patients there was extremely effective. So that in itself, and then also working with my dad, which had rheumatoid arthritis, working with him, I was able to help him, and this was years before I actually went to massage therapy school. And he got a great deal of relief from me working on him gently, like you would as a massage therapist. And so that got me interested in massage therapy. So ended up going to school. And at that time, I had no chronic pain issues, no issues with pain whatsoever. But then I joined the military, and I had an injury from the military and a training accident. And I began developing chronic pain issues and autoimmune type issues, and massage therapy has been a major relief for me dealing with that pain from the injury, the residual pain and stress related things in relation to that injury. So, massage therapy has just been with me throughout, even as a teenager. I have grown to respect the benefits that massage can offer. And I guess the stress benefits, a lot of people don't realize that the extra stress that is put on the body and the mental state exacerbates pain as well. So helping relieve that stress not only helps relieve the stress mentally, but it helps relieve your physical stress in your body as well. And the pain that's associated with how that exacerbates it.
Well, how does the massage therapy fit in with the autoimmune issues you were talking about? How does that help for those who might be dealing with that as well?
Okay, so massage therapy, was that directed toward me? I'm
Yes,
assuming.
whoever wants to answer.
Okay. So massage therapy does help relieve stress in relation to autoimmune. And for me personally, it uh, lighter touch with massage therapy helps to relieve the pain associated with the nerve conditions that I now experience. So it helps to relieve that. Um, it's not exactly neuropathy that I'm working with, which massage helps with that as well. But I am dealing with fibromyalgia and some other chronic pain conditions that constantly refer pain. And so the touch and the massage in general helps to break that cycle of pain, if that makes sense. There's a cycle process that happens with that, and when that cycle is broken, the pain is interrupted.
Okay.
I know for me, I have, and I am not a massage therapist or whatever, but I am a very big proponent of it, for sure. Um, I have had multiple things that I have had experiences with. For me, I know my mother, she was diagnosed with cancer last year, and the crazy thing for me in my case is, or my mother's case is, she knew something was wrong. She couldn't figure it out. She would go to the doctors, everything was fine. She was getting her mammograms and all of that done, and everything was fine. But in the process, she also volunteered in a hospital, and they had a massage therapist that, because she was working for the hospital, they had a very great price. And so she was taking advantage for it because she always had like shoulder issues in her muscles. And all of a sudden, it ended up being that this massage therapist, after working with her for a while, was like, I noticed that your lymph nodes seem to be inflamed. They don't feel right. And so you might want to get the lymph nodes checked out. And my mom was like, really? Okay. So she went and specifically asked to have her lymph nodes checked out. And that's how they found her cancer. It wasn't with the mom, all the traditional medicinal ways that you would think. Um, and she ended up having stage 3 cancer. And luckily, she was able to get treatment and everything in time. But it was a massage therapist who actually found her issue and was able to tell her, you need to look more into this. And that is something, that you normally wouldn't think a massage therapist finding cancer. Like, that's not necessarily something you think of. Um, but it's definitely something that um, it ended up being what helped save my mom's life, was a massage therapist. And
Viola,
again, most people don't think of massage therapy as like in the medical field, because people don't. It's like an interesting lack of connection, but it really, really is. And I don't know if you guys can kind of talk a little bit about that aspect of it.
yeah, Viola, I was going to ask, is that a common thing for therapists to discover, or is that just one of those freak accident things that they discover, or is that actually one of the benefits of massage therapy can do for someone?
So it's not uncommon for a massage therapist to be the one that discovers something on a person's body. Now, certainly, it's outside our scope of practice to do any kind of diagnostic or diagnosis. So the therapist can't really say anything except recommend that you go see your healthcare provider. Or, I noticed this, you need to go have it checked out. But if you think about it, the massage therapist's hands are in constant contact with the entire body. And as you develop that skill, I mean, you become really sensitive to what a body is supposed to feel like. And so you're doing your effleurage and your petrissage along the body, and then all of a sudden you're like, oh, well, this doesn't feel right. What's going on here? And certainly there are lymphatic massage therapists who specialize in lymphatic massage, and they usually work hand in hand with medical referrals. Um, so that's something that you can specialize in, is to help flush the lymphatic system. And there's many massage therapists that go into that work, and people that are going through the treatments for cancer. The massage therapy helps them to manage the intensity and the suffering that they're going through from those treatments. Um, yeah, it's actually not as uncommon as you might think it would be. But whenever the students like they take the pathology class and they look for skin, like anomalies of the skin. So there you are, you're a massage therapist. Who's the person that's going to see that maybe first before anybody else sees it? And they'll come across an anomaly on the skin that they go, oh, I saw that in pathology class, right? And they go, you know, you need to go see your healthcare provider. There's something going on here.
Exactly. If I could chime in for a second, Viola, I completely agree with everything you were saying. So a massage therapist can um, work on the body, but each body's a little different. But if you're seeing that massage therapist regularly, they can tell if something's different with your body. And so they will be able to pick that up pretty quickly. If you're seeing them regularly, they'll be able to say, okay, your lymph nodes were not like this before. You know, there's a change here. Maybe you should get that checked out, or any other thing that appears that is a change. They can certainly see that because, as Viola was saying, their hands and they're looking at the body, they're touching the body, they're there. They can notice these things.
I know that
Interesting.
uh, I mean, I have a friend, and Viola has met her, my friend Kathy. She's one of the massage therapists. She's been doing it for a lot of years. And in her case, she started um, a lot of her work because of some issues that she was having in her female reproductive system. And that's something that I don't think a lot of individuals think about either. Are some of the, options that are kind of off the cuff, kind of like you mentioned, you can specialize in lymphatic or maybe in the reproductive system or in certain areas, and how that can benefit you um, as a client, if you're looking for relief in certain aspects of your health. And I don't think most people think of, oh, the Swedish, oh, I'm going to relax, but there's so much more um, that I've found throughout my life as I'm meeting these individuals that are really specializing and looking at different aspects. And I know that you guys mentioned like the lymphatic system. Are there, can you kind of maybe talk a little bit about some of the other specializations that people can have as a massage therapist that can be really beneficial for the health of others?
Certainly. And there are hundreds of them. um, But specifically to your friend Kathy, Kathy specializes in the Arvigo abdominal techniques from a woman, Rosita Arvigo, who studied with the traditional healers in Belize. I met Rosita 20 or more years ago, and I actually went down to Belize and studied with her uh, for the first 7 days. So it would be like taking level 1 of abdominal massage. And I know Kathy continued her education and became a certified instructor in it. So abdominal massage, for sure, these techniques are from the traditional healers and the midwives in a country that is not industrialized and doesn't have the Western medicine that we have, where people are still depending on, uh, again, the traditional healers and from the indigenous cultures. So the abdominal massage technique is amazing for female reproductive problems. From women who have pain during their monthly cycles. You can use the technique, teach the client the techniques to take care of that, to ease those cycles. Um, it's interesting to me that in this field, whenever the therapist is ready, the clients show up, right? So I had never had anybody show up at my massage clinic who said, I want to become pregnant. I'm having trouble getting pregnant, and I'd like to become pregnant, and I don't know how. I have no idea how my name got out there for this because wasn't advertising it, but I had taken the abdominal techniques, and one of the benefits of working with the abdomen in this specific way was that it helped straighten all of that tissue out in there and all of those organs, and then it was easier for people to get pregnant, for women to get pregnant. So sure enough, sh- this she was a young military wife. She came to see me, I don't know, it wasn't just a couple of times. And next thing I knew, she goes, "Okay, I don't need to see you anymore. I'm pregnant." So that's the Arvigo abdominal massage techniques, and they are very helpful for women for sure.
Awesome.
The other technique, Ginger, do you have any techniques that pop into your head for specialization?
I was thinking along cancer specialists, people that work with cancer patients specifically, also orthopedic massage therapists that work with injuries and things like that. Um, and we've already mentioned lymphatic specialists. Should have brought a list. There's so many. I just think of them all at one time.
Neuromuscular pain relief, myofascial release, cranial
Yes,
sacral therapy.
cranial sacral, yeah.
Now,
And
cranial
So
sacral to me is it's another one of those
powerful.
where I took the basic introduction course, level 1, and I think there's 6 or 7 levels, and I got such great results from level 1. I never went on and studied level 2, 3, 4, 5, and 6 and got certified. But cranial sacral therapy was discovered in the osteopathic world, but they would train anybody that has a license to touch and that does hands-on work. They'll train. You can go to school for cranial sacral therapy, and this is about normalizing the cranial sacral rhythm, the rhythm of the cranial sacral fluid as it travels up the dural tube from the sacrum and flushes over the cranium, and balancing out that cranial sacral pump that most people don't even know exist. And so they've fallen on their sacrum, uh, water skiing, snow skiing, ice
For those
skating.
people that don't know what the sacrum is, can you
yes,
just
your
like
tailbone.
specify? Thank
Yeah,
you.
your tailbone. She's talking about
the
the
di-
pelvic area.
the
Yeah.
big diamond-shaped bone just before your tailbone,
Yeah.
That's my problem.
Thank you.
at the bottom of your spine. So people have injured their sacrum and they've damaged their tailbone and they don't know it. Well, then that soft tissue gets all caught up in there and that stops those bones from moving. Well, that's supposed to be a pump that's pushing the cranial sacral fluid up the dural tube to flush it over the gray matter in the cranium. And if that tailbone and that sacrum is caught up and can't move properly, well then there's all kinds of things that happen to a person, or they start experiencing all these anomalies um, because their cerebrospinal fluid isn't moving correctly up the dural tube. So that's what cranial sacral work is about.
It's amazing
And
how much stuff is connected
and
and how one little thing can affect
Yeah.
the rest. That's just amazing.
it's
And
like
You
that.
guys had
so that's
mentioned,
that's why it's
Ginger, I
called
believe you
connective
mentioned
tissue.
orthopedic work. And I know one of the benefits of massage, you see athletes all the time get massages and so forth. So for the general Joe who's working out, how can the massage therapy help with the workouts or with your exercise performance and those kind of things?
Well, true. There's sports massage, and so having massage therapists work on you as an athlete can help to well, basically help you increase your ability and athletic performance. And there are different times in which the massage therapist would work on an athlete, but doing helping to flush out the toxins that build up as an athlete to help to uh, keep the muscles limber and moving like they're supposed to. Kind
Stretching.
of that's the basics and how and making sure everything's just working the way that it needs to work. And
So we're talking about like joint movement and those kind of things, flexibility and all those contributing to an overall performance, better performance or enhanced performance.
Yes, yes.
You're also talking about mobilization of soft tissue. So the thing that people don't realize is that by its nature, soft tissue contracts and knots up on itself.
Hmm.
And if you don't intervene like if you sit for hours in a chair and then all the tendons and the ligaments in the back of your legs, on the back your calves and the back of your thighs, your hamstrings, all of that gets shorter and tighter and shorter and tighter.
Mhm.
So you have to intentionally stretch that out. And then if you're hands-on work, you do myofascial work, then you're actually getting in there, the therapist is actually getting in there with her hands and mobilizing that soft tissue and opening up that tension so that the ligaments and the tendons and the fascia is free and mobilized.
Oh, see if that there's any of my students out there listening to this. See, I was not lying to you when I said the stretching after a workout and before a workout is just as important because it helps the muscles contract when you work out. So the stretching helps loosen that up, and massage will only take that one step further to kind of help you get over that muscle soreness and help your body perform the next time you go out there and do a workout. So I wasn't lying to you.
It's the simple things that really matter.
Yes.
It
Good
also
deal.
helps prevent injury
Exactly.
uh, for athletes, and then recovery after exercise.
Okay. I just know
Awesome.
that we have a lot of people who like to work out and get out there and work out, and I thought maybe if you guys explained how the massage therapy can benefit those that will help increase their performance, and because a lot of times people get out there and work out and they say, "Oh, I'm so sore, I don't feel like doing this," and they virtually, relatively give up on their program. So this is just one way that they can help continue to that health goal that they've started. So.
No, one thing that might be good to mention is specifically for athletes that are participating in any kind of competition or where they need to have performance, you don't want to see a massage therapist right before you go to compete. um, or it would be great afterwards. And if you're not competing, obviously in between, but right before a competition, if you were to go see a massage therapist, they're going to then relax the muscle and tendon movement pattern. And so someone that is really it's really important that they keep that pattern because that's what they've practiced doing. Does that make sense? So as an athlete, um, but as opposed to right at the competition, anything before or after that would really help improve performance. Did I explain that well enough?
Yes, yes, perfectly. Thank you. So,
So it's not unusual. I mean, what used to be, I don't know what people are doing now, but if there was a run, say some town or organization was hosting a 5 mile run, a 10 mile run, 15 mile run, 20 mile run, that there would be a big tent at the end of the run, and there would be massage therapists in there working on the feet and the calves, and mostly the hamstrings and the calves, and the glutes after a run, and lower back also, I'm sure, but or a bicycle ride. If there was somebody hosted a big bicycle ride, they like the Hotter Than Hell 100 up in North Texas. There's a big massage therapy tent at the end of that ride so that the cyclists can get relief from the tension in the muscles in their legs and stuff.
That'd be my
And
favorite part.
Worth
That's a
doing the
reward.
bicycle ride for, right? That's what I'm saying.
that might be the only reason to join that run or that bike ride,
Yeah.
huh?
is there a way, because when you finally feel the movement of your muscle, soft tissue, and all of this, like Jennifer was saying, yeah, that would be my favorite part. Is there like a mood part to this also in terms of how people feel after a massage versus before, or if they're having mood issues, how can a massage be helpful that way?
So yes, massage therapy also helps stabilize the emotions and the mood. So we say body, mind, and spirit. It
Yes.
works on all three levels, physically, emotionally, mentally. Um, and to that end, um, I worked part-time 5 years with the Warrior Combat Stress Reset Program out on Fort Hood. So people don't often think of massage therapy in the behavioral health field. However, massage therapy is profound in the behavioral health field.
Yes, it
We
is.
did massage, Reiki, reflexology, yoga, Tai Chi, Qigong, sound meditations. There was a full-time acupuncturist. So we were an alternative healthcare modalities team that worked under a group of clinical psychologists and social workers and counselors. And the soldiers that were coming back from Iraq and Afghanistan that had been deployed 7, 8, 9 times at that point. And they were in an attenuated state. They were always hypervigilant. They were in a hypervigilant state. Um, and they couldn't function at the unit level anymore once they came back to the States. So they would come to the reset program, was what we called it. And for 21 days, they were assigned to the clinic Monday through Friday from 8 to 5. And we would take them through a relaxation intensive. And what the psychologists would tell us was that in this hypervigilant state, the soldiers were up here and the psychologists couldn't get through to them, couldn't talk to them at the heart level. But after going through their relaxation intensive, they would be brought down kind of to the heart level, and the psychologist could actually talk to them and make progress with them at that point. So the Warrior Combat Stress Reset Program, we were out there for 5 years, and we came out #1 in the Army for reducing PTSD scores on the average of 16 points in 21 days. So it was quite the intensive.
Again, it just goes to show how things are so connected. We talked earlier about how the body and the mind work off each other, but the massage therapy aspect of it really does play a strong role in the mental capacity and the mental health of people. So again, that's a huge benefit to me for a lot of people to pursue a massage.
You know, for stress management, so we moved a little bit out of the, not that we weren't dealing with pain at the reset program, but we've moved a little bit into the stress and relaxation area here. So I'll tell you my stress and relaxation story. I told you my pain management story, right? So let's see. My husband's active duty military, and they sent him overseas for 2 years. At the same time, I was working full time out on Fort Hood, uh, Monday through Friday, 7:30 to 4:30, in a situation where 3 Corps was gearing up for combat. So this was Desert Shield, Desert Storm timeframe. They sent my husband away, and here I am. I'm working full time. I'm going to graduate school in the evenings, 4 days a week, and then studying Fridays, Saturdays, most of Sundays, and taking care of the house and taking care of the yard and taking care of the cars and taking care of the bills. It was by far I mean, I was in my early 30s at the time, but it was by far the most stressful time that I had ever experienced in my life. And I saw a massage therapist once every 2 weeks on Thursday at 5 o'clock. And I can tell you that that 1 hour of peace that I had in my life saved my life. And I know that. Then that was how impactful that stress relief was for me.
Yeah,
I
that's
I
strong.
have I have Tony on Facebook, and he's letting me know that he actually went through that program. Um, He said I was in the reset program, and I asked him how was it helpful, and he said it was a very good program. It helped me a lot with my PTSD symptoms. So thank you, Tony, for sharing.
Awesome.
Because those are some of the, it's nice that we're talking about it, but sometimes getting that feedback from, people that are tuning in, it feels really nice, so that others can see that what we're talking about is actually something that is real and that can actually be helpful to somebody in maybe a different capacity. So thank you. Oh, you're welcome, Doug. Thank you, Tony. Really glad that you're chiming in. Thank you.
Yeah, we often think about massage therapy as a way, just as a stress relief in some respects that, oh, I feel so good afterwards, or my body feels relaxed. But again, Viola, you took it a step deeper. You realize just how much of a lifesaver something like that can be when
Right.
everything. And we have students that are almost in that same boat. We have single parents who are trying to go to school and deal with being a parent and plus working full time. That can be very stressful. We have and plus, they're thinking about their grades or finishing a class, that kind of thing. They might have some marital issues. They might have their spouse deployed, that kind of thing as well. So all of those things, they're so much deeper than just, oh, okay, I feel good now. It really
Right.
goes a step deeper, and that's important for people to realize that massage therapy does that, and not just a touchy feely feel good thing for the moment. I mean, it really can play an impact on you.
I would take it almost, and I would say even a step further. I think we as humans, and this is kind of hard right now in the COVID world, but we as human crave touch, and that's one of the main aspects I think of the massage therapy is we crave touch. We have to be really, really careful now. I mean, we always have had to be careful, but let's just say that now we really have a consciousness of being careful of who touches you and how and all of that, and having the opportunity, especially people that feel alone, that don't have necessarily somebody with them or near them, that can give them a hug, or that can be, physically intimate in a positive way. Um, it can be really, really hard. And I remember when I was young, I would actually go and get, again, I used to work in Disney, and so every once in a while they give us these specials for the massage therapy, for cast members. And I would go and do that because I craved touch. I had nobody near me that I felt comfortable touching me or being near me, and I needed something or someone. And I would go get the massage, and it was, yes, it was relaxing, it felt nice or whatever, but it was way more than that. It was really about having that feeling of, okay, somebody is touching me, it's an appropriate thing, it's, I needed that. And I don't know that a lot of people are even aware that that's a need that they have, or that how relaxing, I don't know that relaxing is the word, but how soothing it can be physically and emotionally just to have somebody touch you in a positive way.
Yeah,
Um,
physical connection is really an important aspect of just human nature, I think.
And we usually speak of it as compassionate, non-sexual touch. So that to find someone, to have someone that you can trust to touch you, um, means everything in the world. It really does.
Yeah. And so I think that that's another aspect that people don't realize, that you as an individual hold that level of stress in your body until you actually allow somebody that you can feel comfortable with to touch you, and then you're like, "Oh my gosh." And it's sometimes it's not even the massage itself, it's just having somebody there uh holding your space, being able to touch you and hold your space kind of, and be in a comfortable environment. That alone can take somebody who maybe is alone, depressed, sad, feeling it in their body. Because I remember I felt it in my body personally. I was like, I would just feel it, and I was like, oh my god, I need something. And I would go to the massage therapist. I was like, I need somebody to hug, I need somebody to touch me, but I don't have that right now. I am by myself. And that could be something that maybe, even like you were saying, as a military spouse or somebody who's by themselves, they may need that, until they can kind of get to a better place. Sometimes just that little transition. can help them get to a better place. I
I,
also, oh,
I was going to say, I totally agree with that in the sense that when I used to go 100 years ago to a massage therapist, the massage therapist I had, oh, I miss this guy so much. His name was Gary. He would sit down with me, before the massage and talk to me a little bit, and he would kind of draw some things out of me and and then during the massage, all that stuff that we talked about before, that stress or whatever was bothering me, it would just alleviate with this touch. So he had a way of drawing the verbal out of me, and then the physical part with the massage part, they would all just come together. It was all over. And you talk about just feeling so much better afterwards, getting all that off my chest, and then getting that physical contact, that kind of combines with that. So I don't know
You
if
released it.
if you guys have experience with that or those kind of things or not, but it
Oh,
was a
yes.
blessing for me. So
Go ahead,
Yes.
Ginger.
Yeah, I was just saying that that kind of thing is very common in the massage therapy world, and stress, I believe, is not given like the respect that it deserves. Just simply relieving stress is an extremely important thing in life in general. And I had mentioned it a little before, but I know that the massage therapy is moving more into I guess the medical side as the years progress. I've noticed the shift and the relieving stress that massage therapy offers, and all the different modalities that are covered with it is just so vital. And when people think about, oh, it just kind of relieves stress, it's dismissing the value of relieving stress in their lives, and how that affects how their body functions in everyday life, how their mental capacities function in everyday life. And having ways of relieving stress on a regular basis is an extremely helpful thing for just regular everyday functioning in life, and then all the things that go with that. So it's in my opinion very important to relieve stress, and massage therapy is an excellent way and avenue in which to do that.
that was very well said.
I have Tony here. He's been talking to me kind of on Facebook, or at least sending little messages. He says the massage therapy was really good for him. He also really enjoyed the music therapy. That was something that was very helpful to him, I guess. And he said he needs that kind of massage therapy. He said he's paying too much out in the community, so um, we might need to. And then I think he really enjoyed the fact that I said that the touch therapy was important. But can we kind of touch a little bit about the fact that the program that we have at the college, sometimes we need people to practice on?
So the massage therapy students, there's state regulations about when they're allowed to touch. So as the students, when they're allowed to touch the public. So as they go through the program, the students practice on each other. They cannot touch anyone in the public until they've had so many hours, 250 hours of instructions, and 100 hours of hands-on instruction. So that pretty much puts us to the end of the program till they roll into internship. Once they reach internship, then they can touch the public, and we invite the public in for internship massages. And that's whenever they practice on the public. But for the most part, they've gotten pretty darn good by then, because we put them through the paces here. They practice on each other. They have to practice outside the classroom on their family and friends. So I guess that's what I would say, is become friends with the students.
Hmm.
So that you can go, they can practice on you outside of school.
Now, when you guys offer those massages, is there a variety? Like I know there's a sports massage, a soft tissue, a Swedish massage, and those different aspects. Is there one that you guys offer? Do you offer a variety, or do you get based on the recommendation of what the student needs?
So this is a basic licensure course by state curriculum. Okay, so the state of Texas sets the curriculum for massage therapy, and basic licensure is Swedish massage
Mhm.
for stress management and relaxation. We do offer during Massage Fundamentals 2, our techniques instructor does teach orthopedic massage, which is more of a clinical massage. And the students, they also learn not myofascial release, fibromyalgia. They also learn the soft fibromyalgia techniques. So, yes, they will sit down and they'll interview a client before their internship massage, and they will make the massage specific to that client, but it's not particularly a technique. They're just integrating everything that they've learned.
Okay. So Tony says you need to find a friend in the class before you're ready.
Me too.
So I said, yes, do that. I was like, or maybe he could take the class. Because that's, do you find that there's like more, the ratio is more female to male, or is it about the same?
I made a really interesting observation about that.
Okay.
When I first started the program, all of the students were female. All of my instructors were female. To the day that I hired a male instructor, I started getting male students. So
Okay.
yes, we have male students in the classroom now.
Yay, that's great. I am not against either one. I happen to be the type of person that for whatever reason I have very strong muscular structure. So somebody that does not have a strong hand uh, ability doesn't work as well for me unless I'm trying to really, really relax. So a lot of times it's easier to find that in a male. I will say that the best massage and the strongest massage I ever got was from a very petite woman who kicked my butt, and I loved every moment of it because it's very difficult. But you could tell she had honed her craft and she knew what she was doing, and she had a very particular strength in her hands and in her body. Um, but I don't know. I guess for me, it's one of those things where in the medical field, a lot of times people don't think of like for nursing for there to be males, but there is a need, and I feel like there's a need also in massage therapy and in some of the other maybe non-traditional things that are fields that people don't think about that it would be beneficial.
Yeah. Yeah, my massage therapist was a guy, and I will sing his praises to the hilltop, to the mountaintops, because that guy, like you said, he was strong enough to get that sports massage that I needed or whatever, and again, he was wise enough upstairs to kind of draw some things out of me that I normally wouldn't, this kind of things that were stressing me and those kind of things. And not to say that's male or female, that could be anybody, but it was just the right person at the right time for me. So.
Yeah.
That's a really good point. Just real quick, you had mentioned the right person at the right time, and the therapist and the client have to be the right fit. So there are many different types of therapists, just as there are many different types of clients, and you get the right fit therapist for you specifically.
Awesome.
I also had a little petite one at one point. I've had male, female, then I had a little petite girl, and that girl got in there. She didn't look strong at all. I was like, oh, this isn't gonna work for me. No, she got it. And then she was also doing my neck and stuff, and she's like, do you ever let anything out? And I said, well, what do you mean? She's like, I mean, do you cry? I was like, yeah, sometimes. Well, do you ever scream and let anything out? I was like, no. And she's like, when you're in your car by yourself, you need to release some also. I'm doing your neck, but I need you to release some too because you have so much built up, right? And I still do. You have so much built up. And I said, oh, okay. So after my massage, I'm looking around. Okay. I do it. And little did I know, two people next to me, they were like, is she okay? Are you okay? I was like, I'm fine. So then I waited until I got home on my driveway and did some screaming. But it helped to release some more pressure from my neck.
Yeah. So you're talking about the emotional aspect of body work there.
Mm-hmm.
There's people say, "Oh, I have a pain in the neck," and I always think and ask them, "Who's the pain in the neck?"
Yeah.
Ooh, uh,
Right? Because
um,
it's not many times it's not just the physical aspect of the pain. It's
yeah.
the
Sure.
The
emotional.
teenage daughters each side.
There you go. There you go.
One for each side.
All right. So I'm going to kind of take the opportunity and maybe start wrapping this up. And I want to say thank you to you guys. I think this has been a great conversation. I want to say extra shout out to Tony for helping add on to
Yay,
the
Tony.
conversation. Thank you, Tony.
Wow.
Bruce, do you have any upcoming events and things that you might want to share with us in a little bit
Sure, we can
while
do
I'm
that.
wrapping
Yeah,
that
we
up?
do have a few things coming up. Of course, this week our library has kicked off Hispanic Heritage Month celebration, so we've got things going on this week. Tomorrow we'll have life stories from LULAC Council 4535, and that'll be on Facebook from 12 to 1:30 p.m. A virtual event, of course. And then on the 28th of September, the Hispanic Heritage Month continues with the Little Joey La Familia, the life story of Jose Hernandez. And, you know, a lot of people recognize him as a Grammy Award winning musician. He'll be on Facebook from 12 to 1 virtually. There'll be a poetry slam in Spanish on September 29th from 12 to 1, again on Facebook. Just some other little things. Banned Book Week commemoration with the library from 12 to 1 on September 27th. If you're interested in helping out adult ed, they're having a children's book drive the 22nd and 23rd. They're accepting books. You can donate them at Building 559, which is our Clear Creek building right on the corner of Clear Creek and Central Texas College Drive. But there's some aspiring actors out there. The Fine Arts Fall Drama production is hosting auditions the 22nd and 23rd at 5 p.m. in the auditorium. The play this semester will be Black Girl Interrupted, and there are plenty of roles for people from all races and all kinds and all male, female, that kind of thing. So check that out if you want to become part of the play. You'll need to have a 60-second monologue prepared as you go into audition. Our band and choir, September 29th, they'll have a midday music break in the gazebo, a live performance from both the choir and the band starting at 12:30, and that'll go from like 12:30 to 1:15. So those are some of the more fun things, but the one kind of business oriented thing is graduation deadline, October 1st. If you're planning to graduate in the fall semester, you must apply for graduation. And that means apply whether you are going to march or not in the ceremony. That doesn't matter. To get a conferred degree, a diploma, you must apply for graduation. And you can email graduation.info@ctcd.edu and take care of that. So, and some more fun things. We got Patio Cafe lunch Tuesday, Thursday at 12 o'clock. And our next Patio Cafe dinner will be October 1st, and that'll feature an Italian cuisine. And hopefully I'm going to be there for that because I love me some Italian food. So anyways, those are some fun things coming up. So.
Yes, we're always there for the food. Not gonna lie.
And you see the bag behind me, that's today's lunch from Great Western's, was it chicken tortilla casserole? So I'm looking forward to digging in. So anyway, another side note, sorry.
Well, being fed goes a long way to healthy body and mind and emotions.
Sure.
And I can attest to that personally. I am a much happier person after I'm fed. Just saying. Um, but I want to start wrapping it up. I want to say thank you to everybody. Is there anything maybe that Viola or Ginger, you might want to like last nuggets of wisdoms for anybody out there?
Maybe Viola, could you mention how, if a person is listening, they want to become a massage therapy student, what would they do and where would they reach out in order to do that?
So reach out to either myself personally, viola.crowder-mosier@ctcd.edu. Go out on the CTC website and under the Department of Health Sciences and find the massage therapy pages there. And all the contact information, all the information about the program is there with videos and everything. So.
Yeah. And one thing I would add, Ginger, though, for those of us who are not looking to become massage therapists, but looking for that right fit with the massage therapy, do your research.
Yes.
Take advantage of the things that we've talked about and use massage therapy as a way to hone your body and your mind in becoming one, but do your research and find that right fit for you.
Exactly. Great idea, Bruce.
Thanks.
All right. So with that, I want to say thank you to Bruce for always having my back, even when we have especially when we have technical issues. Jennifer, who always is helping me maintain sanity as well. And then, of course, our two presenters who have been amazing and given us all this information. Thank you very much. We hope to have you in October. I don't think we have a date yet set, but we hope to have our next Eagle Talk. And then we'll go ahead and keep this program rolling. If you have any suggestions or things that you're interested in, please go ahead and email us at mvargas@ctcd.edu. That's my email. Or slife@ctcd.edu. That's for student life. Jennifer and I can both check those. So without further ado, I want to say thank you to everybody that participated, and you have a great day, and we'll talk again soon.
Thank you so much.
Thank you.